Good day everyone, I am 𝐬𝐨𝐜𝐴𝐚𝐥, and today I will be showing you my return demonstration in performing the immediate newborn care. All newborns require essential newborn care to minimize the risk of infection and to maximize their growth and development. So prior to the conduct of the procedure, I am going to perform thorough hand washing to deter the spread of pathogenic microorganisms which causes disease and contamination. So after performing thorough hand washing, I have prepared the necessary equipment needed to conserve time and energy. So I have here a weighing scale, vitamin K, eye ointment, operating sponge, a thermometer, a cord clip clamp and scissors. I also have a cotton ball soap with alcohol, a kidney basin, a tape measure, sterile gloves and working gloves, and baby's clothes which includes a mittens, shirt, and booties. I also have an alcohol and a drop light and a stethoscope which will be used later. So the next thing we're going to do is to properly identify the infant using the name tag or wristband. So this will help us prevent misidentification and medical error. Okay. And also, we need to make sure the infant's comfort by ensuring that the environment is warm. So due to wetness after birth and lack of fats, newborns are at risk of hypothermia. So I'm going to adjust the room temperature. Okay. And now, I am going to put on my working gloves to protect the infant from contamination. So now we're going to properly weigh the infant. So this is done since it is the part of the baseline data. Okay. So I'm going to support the head and the buttocks of the infant. So assuming that this is the newborn weighing scale, so I'm now going to get the infant weight. Okay. So the average weight of a newborn is approximately 3.2 to 3.4 kilograms. So now for the cord dressing, so this basic care will help us prevent infection, and also this will help the umbilical cord stump to fall off and the navel to heal more quickly. But before that, we're going to replace our working gloves with sterile gloves and properly restrain the upper and lower extremities of the infant. So this is for us to avoid cross-contamination and accidental injury during the cutting of the cord. So I'm going to remove my gloves. I'm going to discard this one. And I'm going to place this aside. And I'm going to perform hand hygiene. Okay. And I'm going to grab the sterile gloves. I'm going to discard this wrapper. And I'm now going to restrain the upper and lower part of the infant. Okay, so now using the operating sponge soaked with alcohol, we're going to disinfect the umbilical cord 3 times from the base upward. So we're going to disinfect from the base, going up, and then discard, and get another one. Discard. So now place an operating sponge at the base of the cord and plump the cord using an umbilical clip 1/2 inch from the base of the cord. Then I'm going to grab the umbilical clip and plump the umbilical cord 1/2 inch from the base of the cord. Okay, so now cut the cord for about 0.5 centimeters from above the umbilical clip and express the remaining blood from the cord with the operation pad, which is placed on the base of the cord, which is this one. I'm going to cut now the umbilical cord. So now we're going to place another operation sponge from the base of the cord, and we're going to pour. We're going to pour 70% of alcohol solution to the cord. So this will promote healing, and of course, this will promote healing by removing the remaining debris and contaminants that surrounds the cord. Then discard this operation sponges. Okay, so now for the vitamin K injection. So this vitamin K injection helps the blood to clot to avoid severe bleeding, and of course this will help the infant since newborns do not get enough vitamin K from their mothers during pregnancy. So what I'm going to do is I'm going to extract the exact amount of vitamin K from the ampule, and then I'm going to inject the vitamin K in the middle third lateral aspect of the infant. But first, I'm going to inspect the infant's thigh. Okay, and now I'm going to extract the vitamin K from the ampule, so assuming that this is an ampule. Okay. And after that, we're going to disinfect the area to be injected. and discard. And we are now going to administer the vitamin K to the infant intramuscularly. Okay, and then discard the used needle and syringe. So always remember to never recap a needle to avoid needle prick injury. Okay. Okay, so proceeding now to the anthropometric measurement of the infant. So this is a clinical tool used to diagnose an abnormally small or large neonate. So we're going to start off by grabbing our tape measure and we're going to start measuring the head circumference. So the normal head circumference of an infant is approximately 33 to 35 centimeters. Okay, and next we're going to measure the chest circumference of the infant. So we're going to place the tape measure under the armpit of the infant at the level of the nipple. So the normal chest circumference of a newborn is approximately 31 to 33 centimeters. Okay, so proceeding to the abdominal circumference, so we're going to place the tape measure at the level of the umbilicus. So the normal abdominal circumference of an infant is approximately 31 to 33 centimeters. Okay, and lastly, for the length of the infant, so we're going to turn the infant to her side. And we're going to start measuring from the head down towards the lower extremities. Okay, so a normal length of a newborn is approximately 46 to 54 centimeters. So now we're going to get the newborn's temperature rectally. So this method will give us a quick reading on the infant's internal temperature. Okay. So again, I'm going to place the infant to her side. Okay, so assuming that this is a rectal thermometer. So now we're going to perform the initial bath of the infant. So always remember to never bathe an infant earlier than 6 hours of life. Or the World Health Organization suggests or recommends delaying the first bath of a baby until 24 hours after birth. Okay. So now, hold the newborn in a football group manner, folding both ears. So this will prevent the water from entering through the ears and carefully washes the newborn's head with the use of baby soap or mild shampoo and wipes dry thereafter. So this will avoid irritation to the newborn skin. So I'm now going to start washing the newborn's head. Okay. Okay. So now that I'm done, I'm now going to place the newborn right here. And I'm going to remove my wet gloves and I'm going to apply new one. Okay. I'm going to discard this. Now that I have put on a new pair of clean gloves, I am now going to thoroughly dry the newborn using a clean blanket that we have over here. Okay, and after that, I am going to put on the diaper, mittens, booties, and shirt of the newborn. So the diaper will hold and absorb the waste of the newborn, while the mittens and booties will protect the fingers and toenails of the newborn, and it will prevent the newborn from scratching their faces. Okay, so I'm going to remove this blanket, and I am going to place this on the medical hamper. Okay, and I have here all the materials. So I'm now going to start. Okay, so assuming that this is a diaper, okay, and I'm going to put on the shirt of the newborn. Okay, so always remember to secure all the ties that is in the infant's shirt. Okay, and lastly, the booties. Okay. So now that I'm done, I'm now going to wrap the newborn in a clean blanket. Okay. So now I'm going to place the newborn on a crib with a drop light on and a name tag on it. So now I am going to place the newborn into her crib. Okay, and I'm going to turn on the drop light. And I'm going to place the name tag over here. Okay. So now for the application of the Creed's prophylaxis, shades the newborn's eye from eye and open one eye at a time by exerting gentle pressure on the upper and lower eyelids. Okay. And apply ophthalmic ointment from inner to outer canthus, making sure that the tip of the medicine tube will not touch the eye of the newborn. So I'm going to get the ophthalmic ointment, so assuming that this is an ophthalmic ointment. Okay. Going to open it, and I'm going to apply it from the inner canthus towards the outer canthus and do the same on the other eye. Okay? So after that, we're going to get the vital signs of the newborn. So I'm going to start with the respirations. So I'm going to place my hand on the abdomen of the newborn, and I'm going to feel the rise and fall of her abdomen. Okay? And count the rise and fall in a full 1 minute. Okay? And now for the heartbeat, I'm going to use a fetal stethoscope. So assuming this is a fetal stethoscope. Okay? And I'm going to use the diaphragm of the stethoscope. So I'm going to place this diaphragm of the stethoscope into the apical pulse of the infant. Okay? Okay? And count the heart rate in a full 1 minute. Okay. Okay. So now that we are done, I'm now going to perform the aftercare of the equipment, and I'm going to perform thorough hand washing to deter the spread of pathogenic microorganisms. And now, I am going to record the procedure done and all other pertinent data, and I'm going to answer questions related to the procedure. So that's it for my return demonstration. I am 𝐬𝐨𝐜𝐿𝐸𝑡 canumay. Thank you for watching.